The importance of setting boundaries in addiction recovery. There are many important aspects to recovery, and one of the most crucial is setting boundaries. When you first get sober, it can be difficult to know how to set healthy boundaries for yourself. You may have spent years letting others walk all over you, and now you need to learn how to say no. This can be a challenging but essential part of rebuilding your life. What are boundaries and why are they important in addiction recovery? Boundaries are important in addiction recovery because they help to define and protect the individual's personal space. They can also be helpful in setting limits for behaviors and establishing expectations. One of the main reasons why setting boundaries is so important in recovery is that it helps you to protect your sobriety. When you are first starting out, you are vulnerable and need to be careful about who and what you allow into your life. If you do not set healthy boundaries, you may find yourself in situations that could trigger a relapse. For example, if you are hanging out with people who are drinking or using drugs, it will be much more difficult to stay sober. It is important to surround yourself with positive influences who support your recovery. When individuals have healthy boundaries, it can be easier to maintain healthy relationships and avoid unhealthy situations. In addiction recovery, it is especially important to establish healthy boundaries as they can help to protect the individual from relapse. It is important to remember that boundaries are not meant to be crossed, and should be respected by others. If someone does not respect your boundaries, it is important to communicate this and take steps to enforce them. It is also important to be aware of your own personal triggers and stay vigilant in setting boundaries to avoid triggers. If you are not sure how to set boundaries or have questions about what is appropriate, speak with your therapist or recovery coach. They can help you to identify healthy boundaries and develop a plan to implement them in your life. Another reason why setting boundaries is important is that it can help you to avoid toxic relationships. In early recovery, you may be tempted to cling to any relationship that you can find, but not all relationships are healthy. If you do not set boundaries, you may find yourself in a situation where you are being abused or mistreated. It's important to be honest with yourself about the people in your life and to distance from those who are not good for you. Finally, setting boundaries can help you to take care of yourself emotionally and physically. If you do not set limits, you may find yourself overextending yourself and becoming overwhelmed. It is important to nurture your recovery by taking care of yourself and setting aside time for self-care. When you set boundaries, you are saying that you deserve to be treated with respect and that your sobriety is a priority. How to create and maintain healthy boundaries for yourself. There are a few key things to keep in mind when creating and maintaining healthy boundaries for yourself. Be clear and concise. When setting boundaries, be clear about what you are willing and not willing to do. This will help to prevent any misunderstandings with others. Stand up for yourself. If someone crosses your boundaries, it is important to stand up for yourself. This may mean saying no, walking away from a situation, or telling someone directly that their behavior is not acceptable. Be consistent. It is important to be consistent with your boundaries. If you allow someone to cross your boundaries once, it will be easier for them to do so again in the future. Communicate with others. When setting boundaries, be sure to communicate them with others. This will help to ensure that they are respected and followed. By following these tips, you can create and maintain healthy boundaries for yourself, which will benefit both you and your recovery. How to set boundaries. If you are not sure how to set boundaries, there are a few things you can do. Talk to your sponsor or therapist about what boundaries might be helpful for you. They will be able to give you some advice and guidance on how to set boundaries that work for you. Second, read books or articles about boundary setting. There are many resources available on this topic, and reading about it can help you to better understand how boundaries work. Third, practice setting boundaries in safe situations. Start by testing it out in a situation where the outcome is not important. This will help you to become more comfortable with setting boundaries and help you to learn which boundaries work. Finally, be patient with yourself. It takes time to learn how to set effective boundaries, and it is something that you will continue to work on throughout your life. Be kind to yourself as you make these changes, and don't be afraid to ask for help if you need it. Examples of setting appropriate boundaries. Now that we've gone over why boundaries are important, and how to set them, let's look at some specific examples of boundaries you might set in recovery. One boundary you might set is not to spend time with people who are still using drugs or drinking alcohol. This can be a difficult boundary to set, but it is important in order to protect your sobriety. Another boundary you might set is not to talk about drugs or alcohol with certain people. This can help to protect you from triggering yourself and getting started on using again. You might also want to set a boundary against letting someone criticize you. This can help to improve your relationship with that person and make you feel more confident. Finally, you might want to set a boundary against doing anything that would put your sobriety at risk. What to do if you are struggling with boundaries? If you are struggling with boundaries, there are a few things that you can do to help get back on track. Talk to someone. If you are having difficulty setting or enforcing boundaries, it may be helpful to talk to someone about it. A therapist, counselor, or sponsor can provide guidance and support. Identify your triggers. If there are certain people or situations that make it difficult for you to stick to your boundaries, try to avoid them if possible. If you can't avoid them, be sure to have a plan in place for how to deal with them. Practice self-care. Taking care of yourself and your own feelings is important in all aspects of life, including setting personal boundaries. Make sure to get plenty of rest, eat a balanced diet, and exercise regularly. Set realistic goals. When you are first starting out with boundary setting, it may be helpful to set realistic goals. This will help to ensure that you are not overwhelmed and can gradually work on implementing more difficult boundaries. By following these tips, you can get back on track with setting healthy boundaries. Remember that it is a process and takes time to learn how to do it effectively. Be patient with yourself and keep up the good work.